Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series that mirrors and complements our educational webinars that we do for our PA students so that we can share and shed some light on real-life examples of how PAs utilize telemedicine in their respective fields. I'd also like to use this opportunity to highlight our amazing members and to serve as an introduction or a networking opportunity so that we can build and connect together. You know that I believe we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thank you so much for joining us. Today I have the honor of introducing you to our newly elected AAPA Director at Large, who is also the immediate past president for Texas Academy of PAs and works as an emergency medicine PA in a level 1 trauma center in Houston, Texas. Hi Eric, how are you?
I'm doing well. How about you?
Doing fine, thank you for asking. Thanks so much for joining us today.
Of course, glad to be here.
Eric, can you start off by stating your name, how long you've been a PA for, the area of medicine you practice in, and specifically how you utilize telemedicine, please?
Sure. So my name is Eric Martinez. I have been practicing for just about 10 years now, and I actually have two jobs. My first job and primary job is working in emergency medicine. I work at a level 1 trauma center here in Houston. And then also I have a part-time, strictly telemedicine job that I do on my free time, essentially.
Great. Can you tell us a little bit more about how you utilize telemedicine in the ER? And then we also want to hear about your part-time job.
Sure. So we use telemedicine. It's a pretty new initiative that we started. It's essentially an extension of the Ask My Nurse line. So when patients call in to Ask My Nurse, if the nurse has a question or they don't know what to do, or they need to get specialty follow-up or something, they essentially kick it to one of the providers and we take it from there. So we really see a lot of everything. We see, patients with post-op wounds that they're concerned may have infections. So sometimes if it doesn't look too bad, we can actually see the wound, we can start antibiotics. Sometimes we can get specialty follow-up if they miss their appointments. So yeah, it's a good tool that we've used to kind of keep a lot of people out of the ER that don't necessarily need to be there.
That's wonderful. And then tell us about your other job, please.
Sure. So I work for a company that is one of the exclusive telemedicine providers for a lot of the school districts in the state of Texas. And basically what we do is patients can schedule with us, and we do everything from just kind of basic primary care to urgent care. And then we even do some workman's comp. Then what I really love about this job is A, I get to work from home, and then B, it's really flexible. There's no certain hours that I have to work. I can just open my schedule whenever I want to, or when I'm free, to kind of supplement my income a little bit.
That's wonderful. So it gives you the great flexibility to adapt to, whatever's going on in your week or your month, as you're so busy in all your other leadership roles that you do.
Exactly. My schedule, just like with AAPA stuff and TAPA stuff, and then also in the ER, my schedule is just completely random. It varies from week to week. So it's nice to have that flexibility.
Absolutely. Can you tell us what you find to be a challenge regarding telemedicine, please?
Sure. I think the two things that are the biggest challenge, sometimes, technology is great and it allows us to do telemedicine, but sometimes it can be a hindrance. If patients have, trouble their microphone, or even I have trouble with my microphone and video, it really can kind of delay care. And sometimes the appointments are really stacked one after another, and it really can come into the next appointment or whatever, and you don't really get to spend the time you need to with that patient. So technology is great, but again, it can be a headache. And the first thing that that was really hard for me at first adjusting is really just not being able to examine a patient. Especially for a respiratory complaint, they're complaining of respiratory issues, and I listen to their lungs. And if they're complaining of musculoskeletal issues, I want to, do Thompson tests to see if their Achilles is intact. And it's kind of really hard to do. But really, one thing I found over the years is that you can really, if you do a good job and you get good at communicating, you can really kind of walk a patient through a lot of the physical exam. So that really, and again, you get most of your diagnosis from your history and that little bit of exam that you can walk the patient through. I don't think there's really any compromise in the level of care that you give virtually.
Wonderful. Thank you so much. And then if you could share with us a clinical pearl or words of wisdom for our fellow PAs and our PA students, what would that be, please?
Sure. I one of my president's project and something that as past president of TAPA and something I've become very interested in recently is this idea of and so vicarious trauma is just the idea. It's kind of like empathy. Basically, it's the idea that our patients' pain and suffering really affect us more than we realize. And that's one thing I've realized just over the last few years practicing is that patients' pain and like the homeless patients that I see, I really kind of have a special place in my heart for them, and it really breaks my heart to not be able to do everything I can for them sometimes. So that really does affect me more than I ever like realized. And so I think that just my, I guess, advice to everyone would be to just be aware of it. Don't be afraid to really acknowledge it and be aware of it, and really seek help when you need help. And really, just the first step is awareness, knowing that that is kind of the issue that might be affecting your mental health and well-being and your happiness at the moment. And then really developing strategies to kind of combat what's going on, and just whether it be exercise, or I got a Peloton and that's actually really helped. It's amazing what exercise and the endorphins you release really kind of help your mental health and well-being, your overall happiness. So that's one thing that I've used too. And then it's really nice having a wife that is also a PA and works in medicine. We can really kind of talk to each other about some of that stuff, and we work in totally different specialties, but we can talk to each other about patients, and definitely have a good understanding of what each other is going through.
Absolutely. Thank you so much for sharing those words of wisdom. And thank you, everyone, so much for watching. And we will connect with you soon. Take care, everyone. Bye.